We were comparing people who just start to exercise, people who moderately exercise for the majority of their lives, and professional athletes, and people who are overweight and sedentary, and they never went to the gym or did any form of training. And inflammation levels in the sedentary overweight population compared to professional athlete was the same. So you have the same level of chronic inflammation as a fit athlete as you would be if you were sedentary and mildly overweight, not the obese. And then we looked at men and women. And if you compare them, women had the highest biological age as professional athletes. They were sky high. They had much more damage than men. And you would see it in their symptoms as well, because they would frequently lose their cycles or would have other consequences of the sports, which could be a loss of bone density as well. So a lot of these things mimic aging. And I think the complexity there is that we try to train everyone as a professional athlete. So even if you go to a random HIIT class across the street, they're trying to push you as much as you would push an athlete. They don't take into account that maybe you just finished a 12-hour shift and you're not getting enough sleep. You're all going to go in there and try to push yourself to the maximum. And also with athletes, female athletes are trained the same way as male athletes. And there are some differences that should be taken into account that we haven't yet fully explored.